You're dispatched to the scene of a local residence where your patient has fallen from a 20-foot ladder. When you arrive, you see the patient, a 34-year-old female, lying supine on the ground, not moving, and her roommate is there to tell you what happened. BSI, scene safe. The scene has been determined safe. My mechanism of injury is she fell from a 20-foot ladder. I have one patient. I'm already calling for fire and paramedic backup. And I'm going to consider C-spot on the way in. General impression, I see a 34-year-old female lying on the ground supine, not moving. I don't see any apparent life threats. And again, the chief complaint is she fell from a 20-foot ladder, and she is unresponsive. Ma'am? Ma'am? Okay, so she is unresponsive. I'm going to have my partner hold C-spine in a neutral inline position and do not move until I say otherwise. So I'm going to check her airway and ensure that it's open and clear. I'm going to use the jaw thrust to check that, and it is open and clear. I'm going to check for pulse and breathing. Her pulse is about 118. She's breathing at 23 breaths per minute, and her breathing is shallow. If there's no gag, I'm going to insert an OPA. However, if there is a gag, I'll do an NPA. I'm going to go ahead and get her ventilated with a BVM and hook that up to high flow oxygen. Her skin is cool, pale, and diaphoretic, which means she's probably starting to shock. I'm going to go ahead and get some blankets. Going to lift her feet just enough so that it's just her ankles, so there's no spinal compromise. And I'm going to expose my patient and see if she has any life threats, which I don't see. I might go ahead and cover her back up, get her under that warm blanket to help slow down the shock. This is a priority load and go patient. I'm going to do a rapid trauma assessment to see what we were dealing with here. So I'm going to decap BLS, take her head. I do find some blood on my gloves, and there's a bump on the back of her head. I'm going to check her facial bones for any crepitus. I find none. I'm going to check her pupils for pearl, and they are pearl. I'm going to check her nose, mouth, and ears for fluid. I did find some fluid in her ears. I'm going to do a halo test and lay that to the side. I'm going to check the back of her neck for crepitus, or for step off, which I did find. So I'm going to note that. I'm going to check her neck for any JVDs or trachea deviation, which I don't see. I'm going to move down to her clavicles to check her clavicles to see if they're stable enough for a C-collar. I'm going to very carefully slide a C-collar on this way. I'm going to move down and palpate her chest for any crepitus, which I don't find. I'm going to also take breath sounds, apex to apex and base to base. And then I'm going to check her ribs. And I did find a flail segment, so I'm going to, on the left side, I'm going to place my hand over that, grab a trauma dressing, tightly put it over there so that the segment cannot flail around and puncture any organs. I'm going to move down to her abdomen. I'm going to palpate all four quadrants of the abdomen. And I don't feel any distension. I'm going to listen to her bowel sounds. And everything sounds normal. Then I'm going to move down to her pelvis and check the stability of her pelvis, which is stable. I'm going to check her genitalia for any bleeding, which I do not see. Then I'm going to move down to her legs and decap BLS, take both of her legs and feet. So I find nothing there. And she's good there. I'm going to do PMS and CRTs in the feet. So I'm going to do that. And remove her socks. I do have a pulse in her feet, but I do not know any movement in her feet. Her CRTs are delayed, which could be because of the shock. So I'm going to move up to her arms. I'm going to decap BLS, take both the arms. And I'm going to do CRTs, and I'm going to check a pulse. CRTs are delayed. Her pulse is there. She still has a pulse. And I'm going to check. Don't have space here, so I have to step over her head, which is bad. So I won't really do that. Decap BLS, take the arms. And same here, CRTs are delayed. I do have a pulse in this arm. So now, on my head man's count, I'm going to log roll my patient to check her back. On the count of 3. 1, 2, 3. Okay. So, I'm going to check her spine, which is good, except for the step off back here. See where she's bleeding from the back of her head. And check her buttocks. I don't see any bleeding. I'm going to feel down the back of her legs, which are unremarkable. And on my head man's count, I'm going to put her under my long spine board. 1, 2, 3. And I'll adjust her as needed. Then I will strap her in torso, pelvis, legs, and head. Once I get her head strapped in, the head man you can let go. We're going to transport immediately. En route, I'm going to give her an IV bolus of isotonic crystalloid solution, 20 milliliters per kilogram. And I'm going to use a 15 drop set because this is a trauma patient. And then I'm going to get a second set of vitals. So her second set, her blood pressure is the same, 123/77, temperature is 98.6. Her blood glucose is 107. She's now satting at 100% oxygen with our oxygen therapy. She's still unresponsive. Her pulse has gone down to 110, and her respirations are normal because we're ventilating for her. We're going to reassess every 5 minutes and take her to the nearest ER department.